Hello, I'm Connor Darcy. I am Deputy CEO here at Money and Mental Health. So thank you very much for joining us for today's session. To give you a bit of background on this topic and why we're interested, we're still relatively a new organization. We started back in 2016, and a lot of what we did at the initial years was just understanding the link between money and mental health problems to make sure that that vicious cycle where when your mental health is bad, it can affect your finances, and when your finances aren't great, it can affect your mental health. That more people understood that and knew what action to take. But with millions of people affected by that in the UK alone, inevitably that won't look the same for everyone. So things like our age or gender, what kind of mental health problems we have, if we have physical health problems, they'll all play a part in how we experience those issues. And another relevant consideration, and the thing we're focusing on today, is about our ethnicity or our race. And part of the research that we've done in the past sort of scratched the surface of this. We looked at a paper that Francesca, who you'll hear from later on, did, looking at the links between ethnicity and our money and mental health. And one of the big issues that came up there was about how important a role financial services firms, and particularly banks and building societies, how important that role is in supporting good mental and financial health, but also how negative that can be when things don't go right. So if those vital services that lots of people on this call and this webinar are providing, they're not hearing from that really significant group of customers, the odds are that they won't be able to properly understand or meet their needs. So I'm going to hand over to Francesca to talk you through the research.
Thanks, Connor. I'll just do a classic bit of sharing my screen. There we go. Okay, so thank you. As Connor mentioned, we were keen to try a kind of different approach to researching for us with this, working in partnership with Toynbee Hall and their community, and importantly, with a greater emphasis on collaboration and co-production, so that people with lived experience of these issues have greater involvement in not just the findings of the research, which is always the case for us, but also in how we go about the research in the first place. In practice, this has meant doing an initial focus group with people from minoritised ethnic groups with lived experience of mental health problems to discuss and design the polling questions, proceeding with the national polling exercise of nearly 2.3 thousand adults with a kind of boosted sample of people from underrepresented minoritised ethnic groups. Another focus group following that to discuss the polling findings and decide what felt interesting to explore in interviews, a series of peer-led interviews, so interviews done by and with people with lived experience themselves, and finally a policy ideation workshop bringing together experts by experience with financial service professionals in person to discuss a lot of these issues and come up with policy solutions. So what did the research find? The polling revealed that among people with mental health problems, half of those from Asian or Asian British or Black British, Black Caribbean or African ethnic groups felt that their ethnicity has negatively impacted on their experiences with financial services. And this is set against a backdrop of a third of all people on average from Asian, Black and mixed ethnic groups feeling this way, which is obviously a smaller but still significant proportion. The research identified that people with mental health problems from minoritised ethnic groups are experiencing a wide range of types of poor and discriminatory experiences. And here we'll focus on kind of the three of the most common broad types. I'll quickly cover each of these, but they do largely reinforce findings from existing research on discrimination and exclusion in financial services. The first is that people felt that staff did not trust them, or that they wrongfully and unfoundedly treated them as suspicious because of their ethnicity. Secondly, people felt that they received a lower quality of service because of their ethnicity. For example, they felt disrespected or rushed or less worthy of staff time. Finally, people felt that it was harder to access services, and especially like affordable products and services because of their ethnicity. But what we really wanted to add to the conversation on this debate was an understanding of how these experiences can impact more widely and often more longer term on people's mental health and their finances, and crucially, of course, what firms can do about it. So the polling found that half of people from mental health problems from Asian, Black and mixed ethnic backgrounds say that poor experiences with financial services harmed their mental health, compared to under a third of those without such conditions. Exploring this in the qualitative research, our experts by experience explained that feeling racially discriminated against by staff could trigger or exacerbate their mental health problems, and that these experiences have a profound impact on people's self-esteem and make it more difficult for people to advocate for themselves, which is something that we know that all people with mental health problems are more likely to already struggle with. These experiences are discouraging people from minoritized ethnic groups from seeking support. And particularly worryingly, we heard about people hiding their mental health problem since they knew they were already vulnerable or exposed to discrimination because of their ethnicity. And so hiding their mental health problem or not disclosing that gave them one less thing to worry about. Turning now to the impact of these experiences on people's finances. We know that people with mental health problems can already struggle to access financial services because of the complexity of these systems, given the symptoms of people's conditions, such as low motivation, memory difficulties, or reduced problem-solving abilities, for example. For people from minoritized ethnic groups, higher barriers to access because of discrimination or even just the perception of that poses a particularly significant risk, therefore, of financial exclusion. Indeed, we can see on the graph here, like more than half of consumers from Asian or Black ethnic groups feel that their poor experiences with financial services have impacted their long-term financial health. So we know that being able to unaccess the right financial services at the right time can directly make people feel less financially secure. But participants also explained that their experiences gave them little faith that they'd be able to get the support they needed from services throughout their financial lives and impacted their confidence to reach out for support. This exacerbated symptoms of their mental health conditions such as anxiety or low motivation, and ultimately left them worried about their financial future. So following the research findings, as I mentioned, we held a policy workshop that enabled us to explore the drivers of these findings at a firm level and at a sector level and think about solutions for change. The key operational drivers of poor experiences that we identified can quite broadly be categorised into three main issues or gaps, as we've labelled them. The first is knowledge or a knowledge gap. The second is a trust gap, and the third is an accessibility gap. I'll run through each of these in turn and our recommendations to tackle them. So firstly, despite the overwhelming scale of poor experiences that we've identified, we found that firms generally lack the data required for a clear and accurate picture of how customers from minoritized ethnic groups, and indeed those with mental health problems, are actually faring at a cohort level. This is despite the consumer duty requirement for firms to have a good grasp of whether customer groups might be experiencing disproportionate risk of harm or poorer outcomes. Firms are reluctant to collect and use ethnicity data for a range of reasons. We found reasons from data protection concerns to worrying about how customers might perceive them if they were doing that. But speaking to a wide range of experts, there is no good reason or legal grounds for firms not to collect this kind of information if they're doing it because they are intending to use it to monitor and improve outcomes for their customers. So to tackle this, I'll recommend two key recommendations here. The first is that the Financial Conduct Authority should publish guidance, such as case study examples, to demonstrate what good practice looks like regarding collecting and using ethnicity or proxy data. And that financial services firms should carry out more analysis on existing customer data on ethnicity and mental health, while working at the same time to implement a process to routinely collect ethnicity data from customers using explicit consent. Secondly, the trust gap. People with mental health problems can already find it harder to trust financial services. For some people, their symptoms of their condition can just make trust more difficult, but also poor experiences where staff fail to meet their support needs engenders lower levels of trust more broadly. And for people from minoritized ethnic groups, distrust in financial systems and institutions is often deeply rooted in personal and intergenerational experiences of systemic racism, resulting in long-standing and inherited kind of skepticism that is shaped by that injustice. Conversations in the workshop, thinking about this on quite a tangible level, demonstrated that a lack of transparency from firms was key, and that was driving low levels of trust among people with mental health problems from minoritized ethnic groups. Research participants felt that the opaque nature of key processes perpetuated distrustful attitudes towards firms and resulted in them lacking confidence that firms had their best interests at heart. When denied a product or service, they were often told that it was simply the system, leading to frustration and fears that biases were embedded in those decisions. So, how do we close the trust gap? Well, building trust is not an overnight process, that's for sure, but discussions did underline the importance of transparency, as I've mentioned, and particularly around lending decisions to counteract fears that someone's mental health or ethnicity might have been a factor. So our recommendation on this is that financial service firms should inform the customer of the main reason behind a decision when they are unwilling to approve an application for credit. And that firms should provide wider support to customers who are declined from credit, including by sharing details of any credit reference agency database used, signposting to resources that can help people to understand their credit score and how to improve it, and where appropriate or where that's an indicator of financial difficulty, signposting people to debt advice. Third and finally, the accessibility gap. There was generally perceived, I think, across the research, a lack of understanding across financial services about the needs of minoritised ethnic groups and about how ethnicity might intersect with people's other aspects of people's identity, in particular in relation to their mental health condition, such as longer or in-person appointments, making communications clearer or in easy read language, and much, much more, which you can find in the report. Importantly, we found that there's a lack of knowledge and knowledge sharing among staff who are customer facing, but who are not customer facing, sorry, but still play a crucial role in delivering positive outcomes for people, such as senior leaders or product designers. And this can mean that products and services are not inclusive or not accessible from the very start, limiting the ultimate effectiveness of even the very best frontline staff members. So, closing the accessibility gap, firms should adopt a whole organisation approach to improving understanding of needs related to protected characteristics, vulnerabilities and intersectionality, from frontline staff right through to product designers and senior leadership. This should include putting knowledge sharing systems in place to ensure that those with such expertise are able and encouraged to share this more widely. And firms should work directly and closely with organisations that represent customer groups with additional and intersectional support needs, including in relation to mental health problems, ethnic identity, financial difficulty, for example, to understand how they can tackle barriers to higher quality support for those specific groups. So we know that the sector has, of course, already taken very welcome action to deliver better and fairer outcomes for customers with all kinds of characteristics, with the Consumer Duty giving this a real big push in recent years. However, it's very clear from the research that for those dealing with the symptoms of a mental health condition, alongside persistent barriers to racial justice within UK financial services, effectively managing and making the most of their money remains incredibly difficult. Of course, resolving systemic, deep-rooted racial inequalities that feed into these patterns of financial inclusion lies quite beyond the scope of this report. But when these recommendations are implemented, we've set out above, that will represent a really significant step towards ensuring better experiences and fairer outcomes in financial services for people with mental health problems from minoritised ethnic groups.
Okay. Thanks, Francesca. That was a very good summary of the research. And hopefully some of the quotes as well that we included there alongside the charts help to bring to life what this really means to people. Right. Next, we're going to hear from Jerry During, who is CEO and co-founder of Money A&E, which is a social enterprise that provides money advice and education services for those facing financial challenges. And they also deliver social policy change and consultancy services, all designed and delivered with lived experience at the heart of what they do. And all their work is aimed at dismantling the ethnicity premium, which is the discrimination faced by diverse ethnic and low-income groups with a focus on financial and economic inclusion. So over to you, Jerry.
Thank you so much, Connor. It was great to see this report. It was obviously sad to see the contents and the impact that it's having on people. But I think the report's really a confirmation of what we see. So as Connor said, I work for a debt and money advice agency. So we're giving people advice who are facing debt and financial exclusion problems on a daily basis. And we're seeing that mental health is one of the biggest challenges that we're seeing today. And especially in debt advice, and what it's doing is basically it means that people who are facing crisis debt and they're facing financial stress are being locked into poverty basically because of the mental health conditions and a variety of structural issues that are basically putting them there and keeping them there. Um, so at our agencies, out of 8 out of 10 people are from diverse ethnic communities. 9 out of 10 people have a registered and recognized health problem, and 6 out of 10 admit that they have a mental health problem. However, the number is probably a lot higher than that, and they're coming in on a daily basis. And I'll just share with you a case study of someone who came into our agency a short while ago, and she was basically homeless. She found that she was basically in debt, and she had what's called a deficit budget, which basically means that you can't afford to pay your essential expenses like gas, electricity. So every month she was falling further and further into debt, and she said it felt like she was drowning. And I've just got a little, I'm going to paraphrase a little quote that she gave to our team at the time, and she said, I I couldn't go out at all during that time. I felt depressed, um, and I felt really, really down. It was getting a lot worse day by day, and then I was clinically registered as depressed after I went to see the doctor. I was diagnosed as unfit for work. I wasn't sleeping. I kept having nightmares that the bailiffs would come to the door. Um, and this is a common story that we see every single day. She did say that until she went to see an advisor at Money A&E, our lived experience team were able to really support her with options and strategies to help her take control. And she said that that was the turning point. I thought it was a really great kind of quote to talk about really how people are feeling in terms of the stress and the debt that they're facing, those crisis debt situations, and really bringing it to life, and how support from advice agencies and other support agencies can really help. Um, so, what I also noticed from the research, it's really highlighted stuff that we've been seeing for many years, and that basically there's really a direct link between structural discrimination, both direct and structural, poor mental health, and debt crisis and poverty. And we've come up with a term called the ethnicity premium. We're working with other agencies as well on this. And what the ethnicity premium is, direct and structural discrimination against diverse ethnic communities and low income groups. And we're focusing on that within the financial sector, within economic activity and financial inclusion. Um, And what this looks like is really that I'll kind of just sum it down. It's a lot bigger than this, but in the financial space, it it can break down into three specific areas, and it's three areas that this report's actually highlighted as well. So one is that negative experiences that they are facing from staff and on the phone in their interactions with financial institutions, but creditors in general, basically when they're in those sort of crisis situations. And there's been recent research that we'll probably hear about as well that we were involved with that actually highlighted this same issue. Um, a second thing is that products, services, policies, practices are all poorly designed to reach this group, both of diverse ethnic communities, but also as those with mental health issues, as we just heard quite clearly from Naheem, feeling really isolated, untrusting of the services that she was receiving. And because those services are incorrectly designed, they're leading to poor stress, they're leading, sorry, to financial stress, they're leading to debt crisis and an exacerbation of these mental health conditions. They are getting worse as a result. And lastly, a lot of people are experiencing a lack of access to financial services and products. So These are all of the problems that we're seeing coming out of the ethnicity premium and how it's really linked to this experience of both diverse ethnic communities, but also those with mental health and general physical health conditions. There's a big link as we look and delve deeper into this and begin to see more of the statistics and the stories that are happening. So the recommendations are all really good, and it's stuff that we will be doing some further work on in partnership with many on the call and hopefully others who will want to join us. We've got a campaign called the Equity in Finance Project, which is really trying to look at these issues. But we want to do a few things with that, and we want to do this slightly differently in order to really support the financial institution and the creditors to really help resolve this issue, dismantle these structural pressures that are happening, and remake them in a way that's really supportive to diverse ethnic communities, low income groups, and those with mental health issues. So the first is that, in terms of those recommendations, which I think are great, we need to really look at redesigning those products, services, practices, and policies with lived experience at the heart. Now, what that means is that we need to invite people from the communities that we're trying to support, customers of the future, to be at the table helping us to design the right sorts of policies, practices, and services so that we can get it right and we can perform well. That means working with community groups. It means working with those with lived experience like Naheem and like the work we do at Money A&E as well with our lived experience steering committees. So that redesign is key. The second thing is, as was mentioned as well earlier when talking about the report, that representation across the business is key. So at senior level, at customer facing level, but most importantly at that design level as well. We need to have that key interaction and that happening so we can remake those policies, practices, procedures with people within our business, essentially helping us to get that right basically and perform better. And lastly, that signposting to agencies in the community that understand, that are part of the groups that we're working with, but also those debt advice agencies as well. I mentioned in the case study from Tracy that she talked about how much that advice helped her to really take control, to have strategies, and doing that alongside getting sort of any kind of health prescriptions and support really helped her to turn the corner as well, and helped her in terms of the mental health condition and the health conditions getting that bit better, as well as obviously dealing with the debt and the financial challenges and strategies they were facing. So that's all I wanted to say, but the report is amazing, and I think that there is a lot of stuff that we can take out of that in order to really take this forward and turn the dial. So yeah, that's all I wanted to say. Thank you.
Brilliant. Thank you so much for that, Jerry. And yeah, lots of it's just really good to hear again about frontline services doing incredible work, which is it's really always important. Great. Next, we're going to hear from Ayesha Begum, who is Senior Manager of Strategy and Impact at Fair4All Finance, and she spends her time across several research projects, all aimed to better inform propositions and product development and drive improvements across areas such as this. So over to you, Ayesha.
Thanks, Connor. Hopefully everyone can hear me okay. It's been really interesting report to see come out, and a very helpful build on some of the work that we have been doing at Fair4All Finance. So we published a report at the end of 2023 looking at the experiences of people from minority ethnic backgrounds and the sort of levers and factors that are going into why people might be experiencing financial exclusion. And to see this report and understand better that intersectionality with mental health is again, like Jerry said, not surprising, and a confirmation of some of those challenges and barriers that we have been seeing and identifying as well. I think there are a few things that stood out to me from the work the team at Money Mental Health have done, which is we know already that 1 in 4 people in the UK will suffer from a mental health crisis at some point, and seeing that figure next to ethnicity and seeing that actually 50% of people who are from a minority ethnic background and having a mental health problem will have financial difficulties is a stark stat, and I think it showcases what a gap there is in terms of providing the necessary support and guidance and providing the right financial products and services to meet people's needs. We saw a lot of those overlapping themes around discrimination, trust, transparency coming through when we've looked at the report, and seeing that being an even exacerbated problem for those suffering from a mental health crisis is, it's sad to see that, and showcases where we can prioritize our attention in terms of the barriers and the experiences people are seeing. And it was really helpful to see some of those recommendations focusing in on around the community engagement, the communication channels that meet people's needs. How do we use and collect ethnicity data to help showcase people's experiences, but to also measure their outcomes, and make sure that financial services are meeting the needs of people from minority ethnic backgrounds and those experiencing mental health issues, and delivering good outcomes for them. And I think, echoing a lot of what has already been said, I think there is a sort of systemic change that needs to happen around how products and services are designed. And one of the things that we're really keen on looking at more and asking for financial services to look at more is around how you be inclusive by design. And that sounds like just a sentence, so what does that mean in practice? But really, it's about understanding and addressing how these experiences are playing out across the customer journey. And that's at all points, and bringing in that lived experience, that lived voice into all parts of the customer journey, whether it's the product development, whether it's the testing, the distribution, the marketing and the comms. That really helps make sure that it is meeting people's needs, but also catching where there might be any gaps in services and products to make sure that they are appropriate. Naheen spoke a bit about safe spaces and how that's really important for people who are suffering from economic abuse or trying to rebuild after experiencing economic abuse. And it's thinking about, well, how does that apply to lots of other groups and lots of other demographics, and how do you then apply that more broadly in, as Naheen very pertinently pointed out, in your marketing and comms, but also just more broadly within businesses, and how they address actually there is no one size fits all, but there are potentially common solutions for multiple groups of people. And it's about making sure that we're thinking that through in an inclusive way when we're designing our products and services. And then I suppose the last few points I'll make around that inclusive by design point. It feeds into all parts of a business in financial services. It's thinking all the way through your sort of senior leadership team, all the way down to your branch staff, and thinking about the information you're equipping people with, and helping them be sensitive to people's needs and understanding where to direct them to, depending on their circumstances. And also, as Naheen sort of pointed out, and there were lots of great quotes in the report pointing out that actually there is a position where people don't have trust and don't have a lot of goodwill and feeling from their financial services. So how can financial services come forward and meet them where they're at currently? Because that trust and that transparency is interlinked, and it takes time to rebuild over time, depending on people's experiences that they've had. So yeah, it's really sobering stuff that we're seeing again, and I think there's lots of work that we can do. And I, in particular, really like the call on how can we think about collecting ethnicity data, and how do we do that in an appropriate way to help develop better customer outcomes, and really keen to sort of find an industry approach to doing that appropriately. So I'll leave that there.
Thanks, Ayesha. And I really like that line on, like, it's not one size fits all, but there are common solutions. I think that's something we talk about a lot when we talk about mental health problems, that a lot of what we think would make a really big difference, or our research community tells us would make a big difference, would also actually benefit lots of other groups as well. Great. Now, for our last speaker, it's going to be Joe Legg, who is head of customer policy and outcomes at the FCA, and she's responsible for coordinating the FCA's cross-cutting consumer duty work, which I'm sure is a topic that lots of people here have been working on, as well as leading on vulnerability, financial inclusion, and partnership work with consumer organizations. So as I said earlier, Jo couldn't be with us today, but she has put together a video sharing the FCA's insights into this research and what she thinks financial services firms can do to improve outcomes for people from minoritized ethnic groups who experience mental health problems.
Hi everybody, I'm Joanna Legg, Head of our Consumer Policy and Outcomes Department at the FCA. First, a big thanks to Money and Mental Health for inviting me to join today's webinar, and I'm really sorry that I couldn't be there with you in real time. But I'm very keen to say a few words to recognise the important work that Money and Mental Health have done to explore how the experiences of people from minoritised ethnic communities in financial services interact with and can compound the impact of mental health problems. We really welcome the insight that Money and Mental Health bring to discussions about the treatment of consumers in financial services through this report. We want firms to better understand their customers so they can design their products and services to meet consumer needs. And research like this can be a real support. Our 2024 Financial Lives survey found that 17% of all UK adults had a mental health condition or illness, which is roughly 9 million adults. And our data shows that consumers with a mental health condition or illness often face challenges and difficulties when interacting with their financial services provider. For example, 29% found dealing with customer services on the phone confusing and difficult, and 25% had put off dealing with financial matters, so, ignoring or not opening correspondence. And when we look at ethnicity, we also found consumers from minority ethnic backgrounds were more likely to report experiencing customer service related issues across most of the product ranges we ask about. So, consumer investments, regulated credit agreements, day-to-day accounts, general insurance products, and more. They were also less likely to hold certain products like insurance, less likely to have investable assets, or even to have a bank account. And that's where the consumer duty plays a really important role. The consumer duty requires firms to act to deliver good outcomes for all customers. It sets clear expectations in respect of many of the themes that are identified in the report, including the need for firms to respond flexibly to different consumer needs and to provide different channels of communication to meet customer needs where appropriate. Building trust lies at the heart of the duty as a whole, and it's a major reason we want firms to consider consumer understanding and effective communication. And we want firms to collect good data and address their knowledge gaps. We expect firms to assess, test, understand, and be able to evidence the outcomes all their customers are receiving. So with all of that in mind, we'll consider the recommendation in the report directed at the FCA. We'll keep engaging with firms to support continuous improvement, and we welcome the further insights that Money and Mental Health have provided through their reports. Thanks again for the opportunity to say a few words, and I'll look forward to hearing more about the rich experience shared today.
Thanks to Jo, and I think some from the FCA are on the call. Thank you very much to everyone for coming along. Thanks particularly to our panelists for all their insightful contributions. And we're really keen to keep talking about this. There's lots of ways to stay in touch with our work, and we often, I think lots of the attendees we've worked with directly through consultancy. So if the kind of issues that we've come up today are of interest, please do get in touch with us. We'd love to talk about it. And any feedback is also really welcome. Feel free to get in touch via email. But yeah, thank you very much. We've only gone 2 minutes over. Hopefully it was worth it. Have a lovely rest of the day.